Every year, thousands of babies are born with spina bifida. It's a birth defect where the spinal column doesn't close properly, exposing nerves to the environment. Most babies born with spina bifida in the United States have surgery soon after birth, but some children in other countries aren't so lucky. A little boy from Algeria suffered terribly for more than 2 years until his community helped raise money to send him to Mayo Clinic.
Unbearable. He couldn't eat, he couldn't sleep. He had to live with this pain all the time.
This YouTube video is not easy to watch. Mounib Fershishi was born in Algiers with a severe form of spina bifida. His spinal cord did not close, and his nerves that control walking and other functions pushed out into a sac of fluid called a meningocele. He could not walk or even sit. His mother, Salima, says her son spent the first 2 years of his life tilted forward on his stomach.
He was in pain, and doctors didn't do anything.
Then the sac on Mounib's back broke. He developed meningitis and slipped into a coma.
His eyes were closed, and he was breathing through a tube.
Doctors in Algiers operated on Mounib, but it did not help. Then, thanks to donations from the community, Mounib was transported to Mayo Clinic.
Probably the only reason the child survived, truthfully, for 2 years was due to the tremendous, obvious love and energy of the mother and the family.
Neurosurgeon Frederick Meyer teamed up with other specialists in plastic surgery and pediatrics to customize a treatment plan for Mounib. First, they cleared his body of infections. Then, Dr. Meyer opened the skin covering on Mounib's spine and put the exposed nerve roots back into the spinal canal. Then, he closed the spinal canal and plastic surgeons closed the skin. No one was sure how Mounib would do after surgery.
He can move his feet, he moves his legs, he can sit down, he can eat with his own hand.
Salima says Mounib is without pain. He can play and laugh for the first time. Physical therapists are helping Mounib get stronger and walk better than expected. Doctors aren't sure how far Mounib will go with physical therapy, whether or not he'll be able to walk unassisted. But now there's a promise of a full, productive life.
I didn't want to lose him. He's my life.
Mounib is only 2.5, but he says when he grows up, he wants to be a surgeon like Dr. Meyer. Mounib's mother says she is overwhelmed by the generosity of people in her community who helped pay for Mounib's trip to Mayo Clinic. And she thanks the many people at Mayo who helped her son survive. For Medical Edge, I'm Vivian Williams.